Hi, and welcome to video blog. And this is about liver cirrhosis. I'm Ted. I'm a third year nursing student in the College of Nursing in St. Jude College. And this is a partial requirement for nursing on NCM 108. And I'd like to acknowledge our academic chair and the Dean of College of Nursing, Sir Raymart Bulago, and the clinical instructor and third year coordinator, Michael H. Gallo. And this is the care of client with liver cirrhosis. This is a partial requirement for NCM 108. What is liver cirrhosis? This is caused by alcohol abuse, malnutrition, infection, drugs, biliary obstruction, and right-sided congestive heart failure. On the alcohol abuse, it's called Lennox cirrhosis, and also in the post-necrotic cirrhosis is the cirrhosis of distal parts of the hepatic system. And biliary cirrhosis is also a part where there is cirrhosis in the biliary, the bile duct, common bile duct, and it also progresses until the destruction of hepatocytes. Also, after the destruction, you will have fibrosis or scarring, and since there is obstruction of blood flow and increased pressure on the portal veins, then you'll have portal pressure, and it's called portal hypertension, and also fatty infiltration. You'll have a fatty liver, and this is induced by alcohol, and you will get portal hypertension. And let's define cirrhosis. Okay, this is a chronic progressive disease of the liver, characterized by diffuse damage to cells with fibrosis and nodular regeneration. It's has widespread scar tissue formation and complication of viral hepatotoxins, bile stasis, and oxide liver that leads to necrosis and fibrosis, which is fibrosis is scarring. All right, what is the manifestation of liver cirrhosis? Okay, let's start with anorexia due to inability of the liver to metabolize nutrients and store fat-soluble vitamins. And also, if you have severe malnutrition because of anorexia, you have severe weight loss. It's called emaciation. And you'll have fever as a manifestation. It was a normal response to tissue damage. Jaundice, or the yellowing of the skin. Pruritus is the itching, and it's like an allergic response. You'll get tea-colored urine due to increased bilirubin levels. Pruritus is due to accumulation of bile salts in the skin. Bleeding due to a decreased synthesis of bile salts in the liver. Prevent absorption of fat-soluble vitamins. Decreased vitamin K absorption will result to decrease in synthesis of clotting factors. Increased resistance to infection, or decreased resistance to infection due to destruction of Kupffer cells, which is unable to perform phagocytosis, and thus the colonic bacteria enters to blood circulation. Portal hypertension leads to hepatosplenomegaly, and hepatosplenomegaly is the enlargement of the liver and the spleen. Caput medusae, or the dilated veins over the abdomen, is like a varicose veins of the abdomen. Spider angioma, or telangiectasia, it's a dilated capillaries over the face and anterior neck. And this is due to elevated estrogen in males, resulting to inability of the liver to excrete adrenal cortex hormones, including sex hormones. So let's talk about Kupffer cells. Kupffer cells are hepatic macrophages and are present in the lumen of hepatic sinusoids. Their primary functions include the removal by ingestion and degradation of particulate and soluble material from the portal blood. They act as scavengers of microorganisms and degenerated normal cells, such as effete erythrocytes, circulating tumor cells, and various macromolecules. They play a major role in clearance of gut-derived endotoxins. And you'll have palmar erythema. It's manifested by the reddish palm due to elevated estrogen in males. You'll have ascites due to venous congestion of hepatic capillaries that leads to plasma leaking. Due also to hypoalbuminemia, result in decreased osmotic pressure, causing from shifting of plasma from hepatic capillaries to the peritoneal cavity or the abdominal cavity. And esophageal varices due to portal hypertension. Internal hemorrhoids due to dilation of veins into the anal canal. Like varicosities cause venous stasis. Okay, the pH causes venous stasis. Dependent edema due to shifting of plasma. Okay, what is ascites? This is a Greek origin. It's called askos, and it means bag or sac. It is the collection of fluid in the peritoneal cavity. Also, you'll have manifestations in males with gynecomastia, decreased libido, impotence, erectile dysfunction, fall of body hair, and atrophy of the testicles. In females, there's the increased androgen, and you'll get hirsutism, is the increased body hair or hair growth in females. They get acne and the deepening of the voice. Also, increased virilism, the increased male appearance of the female. The asterixis or liver flap is due to elevated ammonia. Ammonia is a byproduct of protein synthesis, protein catabolic process, which protein becomes energy, and the byproduct would be ammonia. And this is manifested by the coarse tremor characterized by rapid non-rhythmic extension. So when you extend your wrist and then you tap it, you'll get a neurological dysfunction that it becomes flapping. Okay, this is called asterixis. So you also get hepatic encephalopathy, and this involves confusion, delirium, hallucination because of the increased ammonia in the brain. And you'll get also fetor hepaticus. It's the fruity, musty breath odor of when you have liver damage. And you'll get irreversible hepatic coma if not followed through, and this is irreversible. And you'll have the hepatorenal syndrome, which affects the kidneys as well. It's caused by becomes known with a sudden decrease in urinary output, elevated blood urea nitrogen, and creatinine levels, and you will see a decreased sodium excretion. When you have decreased sodium excretion, you will have more fluid accumulation in the body. And let's have the management of the liver cirrhosis. Okay. We start with promoting rest. It's you will see that the person with liver disease will be easily fatigued, and with ascites, they'll have difficulty of breathing, shortness of breath. So when you promote rest, you put the patient in a high phallus position so that it would not reach the ascites would not have pressure on other parts such as the lungs, since it's in the cavity, and it will also relieve pressure to the diaphragm so that the patient can breathe better. And on a diet part, you should have a high calorie, high carbohydrate at the early stage of cirrhosis, but low in protein and fat restrictions at the later point because of the decreased function of the liver, the lobules. That's the basic unit. We also provide vitamin A, D, and K, B complex, and vitamin C. This would help regain. You could give it might reverse the damage of the liver, since the liver is a regenerative organ, one of the most regenerative organs in our body. And also, we'll give measures to prevent pruritus. Usually, when you have pruritus, you wash it with warm water, not hot nor cold. Change position so that it won't have pressures in just one area of the body that may cause irritation. You change the linen and gown regularly because of the flaky, dry skin that a person with cirrhosis would have, and try to keep the environment cool. The coolness of the environment would provide comfort. Also, cornstarch or oatmeal baths is good. Bismuth salts, salt bath provides comfort, and administer oral cholestyramine resin that enhances the secretion of bile salt by feces. So the bile salts would be reduced and would be excreted through the GI tract. You prevent trauma. You minimize the parenteral injections. Use small gauge needle if possible, and apply pressure at injection sites for 5 minutes. Avoid vigorous nose blowing. It increases ICP, and since you have a presenting um, portal hypertension, you need to reduce more straining and pressure by uh, avoiding vigorous nose blowing. Monitor for melena, hematoma, and hematemesis is just it's also part where the vitamin K is not absorbed, so the clotting factor would be reduced, so you might have bleeding in the GI tract and other parts of the body. Also, the hematemesis or the vomiting of blood in the upper GI, and in this part, the hematemesis can also be caused by esophageal varices rupturing. So you also monitor for that. Protect the client from an infection. Since we talked about Kupffer cells that ingest bacteria and then toxins, they go down in levels. So you administer neomycin to block ammonia formation. Also, when you block ammonia formation, you remember that if you have ammonia formation and concentration in the brain, would give you a hepatic encephalopathy, and you'll get delusions and stuff. And also, now you elevate the head to minimize difficulty of breath due to the ascites, as I have discussed earlier. And how do you minimize ascites? You start with sodium restriction and fluid restriction, at least 2,000 milligrams of sodium per day would be advisable. No more than that. Also, on the fluid intake, there would be in a different levels or stages of the renal disease, you will have a lesser and lesser fluid intake because of the ascites. You also administer spironolactone as prescribed. It's a potassium-sparing diuretic, and it should keep the potassium level. We need potassium in our body, and we need some level of potassium in our body. Also, if we have sodium as a problem, you also administer Lasix, and this is a loop diuretic that would also give excretion to the rest, sodium and potassium levels, so that it will be dropped. So to prevent hyperkalemia. Albumin IV is prescribed to increase osmotic pressure and prevent plasma shifting. And we induce parasynthesis. It's also called the Levine peritoneal venous shunt. And parasynthesis is the aspiration of fluid from the peritoneal cavity. And first thing you have to do is to secure consent. Check initial vital signs for baseline, and ask client to empty bladder to prevent puncture, because you'll try to puncture the abdominal cavity, and if you don't empty your bladder might be the one who's getting punctured. try to place the patient in sitting or upright position. And after paracentesis, you monitor for bleeding or peritonitis, which is the board-like feel of the abdomen. It's a board-like abdomen. It's also a sign for peritonitis. Okay, what is the Levine peritoneovenous shunt? This is a permanent shunt, and to remove uh, ascites. And the distal end of the catheter is placed into the abdominal cavity, and the proximal end is inserted into the superior vena cava. As the circulating volume is increased, the client is expected to have increased urine output. So you'll have more fluid coming out of your body. So you prevent the rupture of esophageal varices and also hemoptysis by avoiding shouting, screaming, yelling, avoid straining, avoid hot and spicy rough foods, and avoid bending or stooping. Avoid coughing, sneezing. Use open mouth version of the sneezing or coughing so that you won't have pressure. And you also administer Enteral or propanol, a beta blocker, so that you will reduce portal hypertension. And you control hemorrhage due to a rupture of esophageal varices. Administer vasopressin as prescribed to lower portal pressure and promote vasoconstriction. And you also can put a Sangstaken Blakemore tube, and you always have to have scissors always available for that. And a porta systemic shunt to supply directly inferior vena cava, bypassing the liver. And let's also have a step for reducing ammonia formation, and lactulose to decrease the pH of the colon and decreases the production of alkaline ammonia, facilitates excretion of ammonia through the GI tract. And since it's very hard for the liver patient to use the urinary function, we try to use the GI facility to excrete ammonia. And also to reduce ammonia, you can also administer neomycin to reduce colonic bacteria. And tap water or normal saline enema following bleeding in GUT. Because blood is protein, and this process increases ammonia as well. So avoid narcotics, sedatives, barbiturates, acetaminophen. Avoid acetyl salicylic acid to prevent bleeding, and definitely avoid alcohol. Alcohol is the main cause of liver cirrhosis, also hepatitis C. And this is a blood transfusion based disease that would the inflammation of the liver caused by the hepatitis C virus and could progress into liver cirrhosis. And thank you very much for watching, and I hope you have insight on liver cirrhosis. And this is Ted in behalf of St. Jude College of Nursing. I'd like to thank you, and I hope to see you soon. Have a great day.